The global mental health crisis is a critical issue with widespread physical, societal, and economic consequences, affecting around 450 million people worldwide and accounting for 32% of all disability-related years. The economic burden of mental illness is projected to reach $6 trillion by 2030. Despite the severity of the problem, mental health budgets remain vastly insufficient, making up only 2% of global health spending. Addressing this crisis requires innovative solutions, including the use of emerging technologies and convergent science. While there are debates around diagnostic accuracy and medical imperialism, mental health remains a key priority for global health efforts. Historically, mental health care has transitioned from inhumane practices to more compassionate approaches, influenced by various historical and social factors. Early treatments were often custodial and coercive, reflecting a time when mental illness was poorly understood and stigmatized. As the understanding of mental health conditions evolved, so did the approaches to treatment. The mid-20th century marked a significant shift towards community care and the emergence of more compassionate practices, moving away from purely biological models to integrative methods that incorporate psychological techniques. This period saw the integration of humanized and psychosocial models, reflecting a broader global trend towards more holistic and patient-centered care. Despite these advancements, the sector continues to face numerous challenges that impede the provision of effective care, underscoring the ongoing need for compassion and collaboration in mental health services. One of the most pressing issues in the mental health sector is the chronic underfunding and resource shortages that hinder the development of essential services. This lack of financial support leaves many individuals without the care they desperately need and exacerbates existing inequalities in access to treatment. Ineffective government policies further compound the problem by failing to address the root causes of the mental health crisis. In many countries, austerity measures, workforce shortages, and inadequate policy implementation create significant barriers to accessing timely and effective mental health services. These issues not only strain the already under-resourced mental health systems, but also contribute to worsening mental health outcomes and social inequality, highlighting the urgent need for policy revisions and increased funding. Mental health professionals often receive inadequate practical training, limiting their ability to provide effective care. Without comprehensive education and ongoing professional development, practitioners struggle to meet the complex needs of their patients, resulting in suboptimal outcomes. This issue is further intensified by high patient-to-therapist ratios in mental health services, which result in overwhelmed professionals and inadequate patient care. Therapists struggle to provide the attention and support each patient requires, leading to reduced quality of care and potential burnout. Burnout among mental health professionals is a growing concern. Constant exposure to trauma, heavy caseloads, and insufficient support contribute to high levels of stress and emotional exhaustion, ultimately compromising the quality of care provided to patients. This burnout can lead to a vicious cycle where the quality of care diminishes, further exacerbating the mental health crisis. The influence of pharmaceutical companies also plays a significant role in shaping mental health care. These companies often prioritize profit over patient well-being, with marketing strategies that can lead to the overprescription of medications. This focus on medication can overshadow other effective treatments and therapies that patients may need, contributing to a one-size-fits-all approach to mental health care. A lack of personalized treatment plans further exacerbates this issue, as tailoring treatments to individual needs is essential for achieving better outcomes and long-term improvement in mental health. Insurance companies frequently dictate the terms of mental health care, limiting access to necessary treatments and therapies. Their focus on cost-cutting measures can prevent patients from receiving comprehensive care, worsening their mental health conditions. This dynamic underscores the need for policy reform to ensure that individuals receive the care they need without financial constraints dictating the quality of treatment. Social media plays a complex role in mental health, offering both benefits and risks. On the positive side, it can enhance connection, provide emotional support, and offer platforms for sharing experiences. However, excessive use is associated with increased anxiety, depression, stress, and loneliness, particularly among younger individuals who are more vulnerable. Negative impacts are often driven by social comparison, fear of missing out, cyberbullying, and information overload. Additionally, social media can affect self-esteem, body image, and sleep quality. To mitigate these effects, mindful and moderate use of social media is essential, recognizing its bidirectional influence on mental health. Misdiagnosis and overdiagnosis in mental health care are significant concerns that can lead to inappropriate treatments and worsen patient outcomes. These errors often arise from ambiguous diagnostic criteria, insufficient evaluations, and the use of heuristics by clinicians. Overdiagnosis, where individuals are diagnosed with conditions that may never cause harm, can result in unnecessary treatments and added anxiety. It has been observed in various mental disorders, including ADHD, depression, and bipolar disorder. Misdiagnosis involves incorrect diagnoses, leading to ineffective care. These issues are worsened by the gap between research and practice, as advancements in understanding often fail to reach clinical settings, leaving patients without the benefits of the latest therapies. Addressing these problems requires standardized diagnostic procedures and ongoing clinician education to improve care outcomes. Minorities face significant disparities in mental health services due to stigma, cultural misunderstandings, language barriers, and systemic bias. These challenges lead to lower treatment utilization and poorer outcomes, emphasizing the need for culturally competent care and targeted interventions. Stigma, often linked with a lack of cultural competence in therapy, exacerbates isolation and mistrust in the mental health system. Additionally, navigating legal and ethical complexities, such as consent and confidentiality, further complicates access to care, underscoring the urgent need for comprehensive, culturally sensitive mental health services. A critical issue in mental health care is the over-reliance on medication, which can lead to dependency and fail to address underlying issues, resulting in incomplete recovery. While medications play a crucial role, recent research highlights the significant benefits of integrating holistic approaches, such as therapeutic lifestyle changes like exercise, nutrition, and mindfulness, which can be as effective as psychotropic drugs for some conditions. However, the current focus on short-term medication-based solutions often overlooks these broader strategies, leading to recurring problems, which ironically create a consistent revenue stream for providers. Sustainable, long-term approaches that combine medication with lifestyle interventions are essential for lasting improvements in mental health and overall well-being. Insufficient crisis intervention services leave many individuals without immediate help during their most vulnerable moments, leading to worsening conditions, higher hospitalization rates, and tragically increased suicide risks. Crisis intervention models such as mobile crisis teams and crisis resolution home treatment have shown promise in reducing hospital readmissions, easing family burdens, and improving satisfaction for patients and families. These services offer a more cost-effective and immediate alternative to traditional hospital care. However, despite these benefits, there is a pressing need for more robust and accessible crisis intervention services and high-quality research to refine and evaluate these models, particularly non-police approaches, to ensure effective mental health crisis management. Education systems are pivotal in promoting mental health by fostering well-being, identifying at-risk students, and implementing prevention and early intervention programs. Schools can play a significant role by providing skill-building programs and improving access to mental health services. Teachers and school nurses are key figures in this support network, with teachers needing to maintain their well-being to care effectively for students, and nurses addressing a significant portion of student mental health concerns. Collaboration between education and mental health professionals is crucial for developing comprehensive evidence-based approaches. However, resource limitations and the need for additional training present ongoing challenges in fully realizing these strategies. Socioeconomic and geographic factors significantly impact access to mental health care, particularly for low-income and rural communities. High costs, lack of insurance, and limited transportation options prevent many from seeking necessary treatment, disproportionately affecting low-income individuals and widening mental health disparities. Rural areas face unique challenges, including geographic isolation and a shortage of mental health professionals, leading to worse outcomes compared to urban areas. These barriers highlight the need for targeted interventions to improve access to mental health services for underserved populations. Family and community support are essential in mental health recovery, offering emotional and practical assistance that significantly contributes to improved outcomes. Families, often defined broadly, provide critical support, helping individuals with mental illness navigate their recovery. Social support networks, including both family and intentional communities, are associated with better mental health outcomes and reduced isolation. Recovery-oriented systems increasingly recognize the importance of family involvement and a supportive social environment. However, fully integrating family-focused recovery practices remains challenging, highlighting the need for systemic changes to harness these vital resources effectively. Short-term solutions often fail to address the root causes of mental health issues, leading to recurring problems. Sustainable long-term strategies are essential to create lasting improvements in mental health care and patient well-being. Tackling the mental health crisis requires a united effort across all levels of society. As a citizen, you can be a part of this positive change. Please check the links in the video description to see how you can help through donations or volunteering with mental health charities. Thanks for your time. Let's make mental health a priority.